spray and stretch is one of my favorite techniques to use, and it's a favorite because I get consistent results with it. Patients like it, and it tends to be something that's very easily performed in the office. We're going to show throughout the course of this demonstration how easy it is to use and the kind of results that you'll be able to get, and you should be able to follow those directions very clearly and get the same kind of results that I do. Now, it has an interesting, rich history. One of the things that I learned was how Dr. Krause had developed this on the basis of, first of all, having a patient and friend who was also a circus performer. And the circus performer was making fun of the medical field in general, saying that it took so long for people to get better from sprains and strains. And so Dr. Krause asked, well, what would you do? Well, apparently they took alcohol-soaked towels, wrapped them around the area that was injured, exposed it to steam, and managed to get some sort of a chilling effect, and they then would take the muscle through its range of motion, doing limbering types of exercises, and this got consistent results. Dr. Krause tried it on his own patients and discovered, yes, in fact, it did work, and he went back and developed the technique utilizing the ethyl chloride spray, which he used effectively for many years. Later on, Dr. Travell decided to come up with a different product based on the fact that the ethyl chloride was rather cold, too cold oftentimes for the myofascial types of treatments that she was giving. And so she developed the fluoromethane product and developed the entire spray and stretch type protocol that we're talking about here. And that happened in the 1960 range. Now Gebauer is on to a new product, Gebauer Spray and Stretch, which is more environmentally friendly. The other fluoromethane was discontinued just due to the fact that it had an effect on the ozone layer. The new product no longer does that. The primary thing I like to use the spray and stretch technique on is for myofascial pain and dysfunction. It's, in my mind, one of the quickest ways to get a good result with somebody. And Dr. Travell used to call this the workhorse of myofascial therapy. And basically what it means is we need to put the person in a proper stretch and apply the technique and get the kind of results that, again, people want to come back and get again if they so desire. So for me, this is the primary reason. Other reasons you might want to use spray and stretch, you might have a sprain, strain type thing going on. Again, that can be very effective. That's, again, the reason why it was initially designed. So those are reasons to use it. Now, the actual procedure that we'll be doing, I showed very oftentimes spraying through clothing. That's an important aspect of this because a lot of the literature talks about always spraying on skin. I find that as long as the patient can feel the spray, they pretty much get the effect. So in cases where people just have a problem with removing articles of clothing, I go ahead and spray right through as long as they can feel it. That's okay. Now, in addition, we want to figure out when we apply the spray and stretch, it's not just a modality that we throw at somebody and say, okay, let's spray that trap and see if it works. What we need to do is we need to think and apply clinical reasoning. What I like to do is think about the nervous system, specifically when I'm working with somebody. So I'll oftentimes treat the suboccipitals to deal with what I believe is the dural tension component. I'll spray the area of the paraspinals that innervates that section where the patient is feeling the pain, and then I'll spray the muscle that I've determined is the one that's most affected. I get very good results doing that, and that's a particular clinical reasoning piece that works. There are a number of other perspectives you can utilize doing that. You can just think in terms of referred pain patterns and treat that way. You might think in terms of muscles that could have been injured during whatever the issue was that the patient had. A number of different protocols that you can do that way, but very important. Now, how to perform it? What we want to do is, first of all, check the range of motion to determine whether or not the muscle needs to be treated. When we treat, we actually put the muscle on that stretch. We want to anchor one side. In this case, if I wanted to treat the upper trapezius, I would hold on to the side of my chair and take up the slack and spray through the muscle and its referred pain pattern. I would want to do 3 to 5 sweeps of the spray and then re-warm the area. I prefer to use a thermophore heating pad in order to be able to do that. Once that area is rewarmed, we can reassess the motion. We can teach an exercise program to maintain that, a range of motion type of exercise program, and make sure the patient performs that on an hourly basis for about 2 weeks in order to retrain that segment to be able to stay and maintain the newly established range of motion. One of the things